Hello, I'm Rodger Charlton. Thank you for listening to this video in my GP practice in my 22nd year here. General practice is about patients, and so is the presidency of our college. It is a privilege to share with patients times of happiness and often pain when the sadness of illness bites in this consulting room. Why then am I standing to be your president? Being president for me is not just about wearing a fellow's gown. It is about you and your patients. It is meeting you at your faculties or surgeries, trainee or established GP, learning from you, hearing your difficulties as you seek to help your patients. I want to know about your successes and your struggles so that these can be acknowledged. I want to make a difference and so not just be a figurehead involved in ceremonial. The college has an excellent chair in Helen Stokes Lampard, and I would see my role as complementary to hers. What matters most to us in general practice? It is patient expectations of us, to be their doctor, to accompany them on the journey, to follow them up when cure is not possible, to be there for them, available and accessible, to be a doctor who listens and is compassionate and so someone who genuinely cares. I'm not blinkered. We have enormous challenges with nearly unmanageable workload and under-resourcing and inadequate workforce. I want to be your advocate as well as your president, to hear your difficulties and celebrate your successes despite overwhelming pressures. I'm still a GP, still a partner. I know what it is like working at the coalface. And it's not just about London, it is about all of the UK, Northern Ireland where I went to school, and my close family work in general practice, Wales where I still hold an academic post, Scotland where I locum in rural areas such as Jura, and England where I'm a GP in the West Midlands. I care about general practice in the NHS where I've worked for over 30 years. I want all in society to have good health care and the philosophy of the NHS to survive. We have a good model of care which is always evolving. I've a lot left to give. We all have, and I want to hear your stories. When you feel otherwise, those just starting out and those nearing retirement, inspiring, recruitment and retention are my watchwords. Although a medical academic, I'm far from being in an ivory tower. I'm involved in a widening participation project so that all can have an opportunity to train in medicine. Currently, 80% of our medical students come from 20% of our schools. I aim to inspire students and trainees. I, like you, am preparing tomorrow's doctors and opening their eyes to the rewards of general practice. I love my work also as a TPD VTS course organiser, to try and hold on to those trainees who have chosen GP and not lose them to work overseas, to help those who struggle with the RCGP exam, to mentor them then as first fives. Socrates came out with a great phrase, education is the kindling of a flame, not the filling of a vessel. That is my job as a GP teacher. As president, I would want that kindling of a flame widened to as many GPs in practice as possible. Currently, my research area is compassion. I want to create awareness of the pressures our junior doctors are under as well as established GPs. We all risk being undervalued, and that low morale carries the danger of us appearing to be dispassionate and uncaring at times. Compassion for our profession filters into compassion for our patients. Everything we should do should be about our patients. That includes looking after ourselves and our successors. A duty therefore on all of us is to be potential teachers and role models. If the GPs of tomorrow are not better doctors than us, then we have failed. Ultimately, it is about our profession and our patients. We need good doctors. We are patients as well. My only distraction is the phrase I keep telling trainees, work-life balance. My family, including my wife who is a doctor, my children with their interested and varying lives, one of whom will start shortly as a foundation year doctor. My love of cricket, whether as a spectator, player or umpire. If you choose me, I know it is not going to be an easy job if done well. Ultimately, it is about making sacrifices, using my experience for our patients, our profession and our college. Thank you for taking the time to listen to me and this video. Thank you.